Welcome to a new session on the course School Organization, Administration and Management. In this present session, we will discuss topics like first aid and principles of first aid and CPR. What does this symbol mean? Although commonly associated with first aid, the symbol of a Red Cross is an official protective symbol of the Red Cross. The internationally accepted symbol for the first aid is the white cross on a green background as shown. Meaning of first aid. First aid is the assistance given to any person suffering a sudden illness or injury with care provided to preserve life, prevent the condition from worsening or to promote recovery. It includes initial intervention in a serious condition prior to professional medical help being available, such as performing CPR while awaiting an ambulance, as well as the complete treatment of minor conditions such as applying a plaster to a cut. First aid is generally performed by a lay person, with many people trained in providing basic levels of first aid and others willing to do so from acquired knowledge. First aid is the immediate care of an injured or suddenly sick person. It is a care a person applies as soon as possible after an accident or sudden illness. This prompt care and attention prior to the arrival of the ambulance can sometimes mean the difference between life and death, or between a full or partial recovery. There are many situations which may require first aid, and many countries have legislation, regulation or guidance which specifies a minimum level of first aid provision in certain circumstances. This can include specific training or equipment available in the workplace, such as an automated external defibrillator, the provision of specialist first aid cover at public gatherings, or mandatory first aid training within schools. First aid, however, does not necessarily require any particular equipment or prior knowledge and can involve improvisation with materials available at the time, often by untrained persons. Definitions of first aid. First aid is the emergency care or treatment given to an ill or injured person before regular medical aid can be obtained. First aid is the provision of immediate care to a victim with an injury or illness, usually affected by a lay person and performed within a limited skill range. First aid or emergency care that is given to an injured or sick person prior to treatment by medically trained personnel. First aid is the help given to a sick or injured person until full medical treatment is available. Originator of the first aid. The originator of first aid was S. Mach, 1823 to 1908. He was born in Schleswig-Holstein, became a distinguished surgeon and was appointed Surgeon General in the German army on the outbreak of the Franco-Prussian War. The triangular bandage was invented in 1831 by Dr. Mayer of Lausanne, Switzerland. Origin of the term first aid. The term first aid was adopted officially in England for the first time in 1879 by the St. John Ambulance Association. The expression first aider was not coined till 1894 and was intended to designate any person who has received a certificate from an authorized association that he or she is qualified to render first-hand aid. Let us now see the need and importance of first aid. If an accident happens at the workplace, you cannot be a helpless witness. since simply standing by can potentially worsen the situation. This is why it's important to have at least a basic knowledge of first aid. First aid is the initial assistance given to a victim of injury or illness, providing quick medical treatment until professional assistance arrives. It affords people with ability to provide help during various emergency situations. First aid helps ensure that the right methods of administering medical assistance are provided. And knowledge in first aid also benefits the individuals themselves. Aims of first aid. The main aims of first aid are to preserve life. This includes the life of casualty, bystander and rescuer. 2. Protect the casualty from further harm. Ensure the scene is safe. 3. Provide pain relief. This could include the use of ice packs or simply applying a sling. And the 4th, prevent the injury or illness from becoming worse. Ensure the treatment you provide does not make the condition worse. 5. Provide reassurance. To reassure the victim and make him or her as comfortable as possible. 6. Promote recovery. Provide appropriate emergency medical care to facilitate his or her easy recovery. 7. Proper treatment. To assess and treat the casualty in the correct order of priority. And 8th is to provide comfort. Place casualties in a comfortable position. We shall now see the scope of first aid. The diagnosis. The first aider should examine the casualty to know the details of the injuries and their nature, and this is known as diagnosis. The first aider must know how the accident or sudden injury has occurred. The information can be obtained from the victim if he or she is in a position to do so, or from a witness or witnesses, and this is known as the history of the case. The next step in diagnosis is to observe the symptoms like faintness, pain, shivering or thirst. Next is treatment. The diagnosis will give him or her an idea of treatment to be given until the doctor takes charge. With a view to prevent the condition from becoming worse, special attention should be paid to cases of severe bleeding, failure of breathing, unconsciousness and shock, etc. Next, disposal. After rendering the first aid, the doctor should be called in to examine the casualty or victim. The next step is to send the casualty to their house or to the hospital, as the case may be, in a suitable atmosphere. The members of the family of the victim, of his or her relatives, should also be informed at once. In any case, immediate treatment is a must. We shall now discuss the importance of first aid training. Knowledge of first aid promotes a healthy, secure and a safer environment and instills confidence among people, their families, colleagues and associates. Basic first aid knowledge is very helpful in dealing with trauma situations. Not just the medical help they provide, but the confidence they exhibit is very helpful during casualties. Being trained to provide first aid is useful to oneself and society for various reasons, like it affords people with the ability to provide help during various emergency situations. If someone swallows harmful substances or suffers health related issues like a heart attack, or if a natural disaster occurs, a person knowledgeable in first aid becomes very helpful. They become an invaluable support not only to the victims but also to professional emergency responders and medical practitioners. First aid helps ensure that the right methods of administering medical assistance are provided. Knowing how to help a person is just as important in emergency situations. It only takes 6 minutes for the human brain to expire due to lack of oxygen. Knowledge in first aid helps to provide appropriate medical care. Knowledge in first aid also benefits the individuals themselves. Whether the emergency affects themselves directly or involves people they live and work with, knowledge in first aid prepare an individual to deal with an emergency in a given time and space. Knowledge in first aid helps ensure safety of both injured and involved. Dealing with emergency without proper knowledge in first aid may lead to make the situation more badly, and it may also cause further casualties. Knowledge in first aid helps to prevent the injury or illness from becoming worse. A trained person will provide a temporary treatment which will keep the condition of the victim from deteriorating till professional help arrives. It does more than help save lives. It is true that having first aid training undoubtedly saves lives. That's not all. Giving appropriate first aid immediately can help to reduce a person's recovery time and make the difference between the patient having a temporary and long-term disability. It increases safety. The basis of first aid training is prevention. It is always better to be safe than to be sorry. Knowledge of first aid promotes a sense of safety and well-being amongst people, prompting them to be alert and safe in the surroundings they dwell in. Awareness and desire to be accident-free helps you more safe and secure, reducing the number of casualties and accidents. It helps relieve pain. Some injuries require a very simple solution like applying ice pack or a quick rub. A ride to the emergency room is not necessary. In such cases, calling a trained person in first aid is more reliable. They can help reduce the pain by performing simple procedures and can help relieve pain temporarily. It makes people more secure. Knowing that you can save your own life when required or that of the people you know or those in trauma during some emergency helps you relax more and be more secure. The sense of security promotes a healthy and a more confident atmosphere around you, and people around you would feel more secure. The presence of such people provides a reassurance to others in the situation. General principles of first aid. The general principles of first aid are: remove the cause of injury or the patient from the cause as early as possible. He or she should then render such help that may prevent further injury. First aid should be confined to essentials only. Restoration of respiration and circulation. Immobilization of simple and compound fractures and dislocations. Assurance of getting well quickly to the victim and moral boosting. The bleeding should be stopped immediately irrespective of other injuries. Keep the patient warm by wrapping him or her in clothes, rugs or blankets and sheets as the cause may be. Remove the clothes of the patient only when essential. Such removal of clothes must not cause pain or discomfort to the patient. He or she should very softly study the ankle and then undo the laces of shoes and cut off the socks if needed. The wound should be covered at once with a clean dressing. In case of a fracture, the injured limb should be supported and placed in natural position as far as possible with splints and bandages. Make immediate proper arrangements to a hospital or a qualified doctor in the vicinity. It should, however, be remembered that the first aider need not be a doctor. So, he or she should never take upon themselves the duties and responsibilities of a doctor. His or her responsibilities are over as soon as proper medical aid is available. The injured should be given as much rest as possible, as their body should be kept in a restful position. In case of fracture, the broken part should be saved from movements till proper medical aid is available. Offer warm milk or tea. If the patient is in senses, he or she may be given a cup of warm milk or tea. Full knowledge of anatomy is essential for giving first aid. The first aider must have complete knowledge of anatomy or physiology. It will enable him or her to render proper first aid to the injured. Immediate arrest of hemorrhage. ABC principles. ABC and its variations are initial mnemonics for essential steps used by both medical professional and laypersons such as first aiders when dealing with a patient. In its original form, it stands for airway, breathing and circulation. The protocol was originally developed as a memory aid for rescuer performing cardiopulmonary resuscitation, and the most widely known initial is in the care of the unconscious or unresponsive patient, although it is also used as a reminder of the priorities for assessment and treatment of patients in many acute medical and trauma situations, from first aid to hospital medical treatment. A or airway. The airway of an unconscious person may be narrowed or blocked, making breathing difficult or impossible. And this happens when the tongue drops back and blocks the throat. While providing first aid, act quickly to open the airway. B or breathing. Check for breathing by placing your head near the person's nose and mouth. Feel for breath on your cheek or moisture on the back of your hand. If a person has just stopped breathing, use mouth-to-mouth ventilation. Make sure the airway is open and head tilted back. Pinch the nostrils together, take a deep breath and blow into the mouth, firmly sealing your lips around the mouth so air is not lost. You should see the chest rise. Remove your lips and let the chest fall. Continue this, giving about 10 breaths every minute until help arrives or breathing begins. C or circulation. Check for circulation to see if the heart is still beating by feeling for the Adam's apple or the lump on the windpipe with 2 fingers. Slide the fingers to the side of the windpipe and feel for the pulse. If the heart has stopped beating, use chest compression to try to restart the heart. Place your hand flat just above the point where the ribs meet the breastbone. Bring the other hand on top of it and lock the fingers together. With your arms straight, press down firmly on the breastbone, pushing it down 4 to 5 centimeters. Release the pressure and repeat the compressions at a rate of about 100 per minute. If the person is also not breathing, alternate 30 compressions with 2 breaths until help arrives. Who is a first aider? A first aider can be someone in an organization who has been trained to give immediate medical assistance given to anyone who is suffering a sudden illness or injury, with care provided to preserve life, prevent condition from worsening, or to promote recovery. The qualities of the first aider. The following are the qualities that a trained first aider should possess. Prompt and quick. As soon as an accident or injury takes place, the first aider should be prompt and quick to render help to the victim without delay. Calm and controlled. He or she should be calm and controlled because he has to take immediate action without any fuss or panic. Wise and intelligent. He or she should be intelligent and wise enough to decide what immediate treatment is essential even before a complete diagnosis, especially in case of serious injuries and severe bleeding. Resourceful. For providing immediate relief to the victim of the accident, the first aider should utilize all the available resources that they can think of. Sympathy. The first aider should display an attitude of helplessness and consideration to the victim so that the victim feels comfortable. Sweet. The first aider should say sweet words to the victim. Skillful and tactful. The first aider should be skillful to provide first aid and should be tactful to control the crowd which usually gathers around the victim and causes undue delay in providing immediate help. We shall now see the concept of a first aid box. A first aid box is a bag or a case containing basic medical supplies that are designed to be used on someone who is injured or who suddenly becomes ill. It is the duty of the school to keep a first aid box under the charge of a teacher qualified in first aid. The things to be kept in a first aid box. The first aid box should contain certain equipments and medicines to enable the first aider to render effective, timely, appropriate aid. A box of 1200 into 100 millimeter sterile dressing individually wrapped for cleaning and covering wounds. A roll of gauze bandage 50 mm for bandaging sterile dressing over wound, etc. At least 3 roller bandage 75 mm into 5 meter, 2 wooden splints, safety pins, pads of various sizes, 2 rolls of adhesive tape 25 mm into 50 mm wide, medicine or eyedropper, rectal thermometer, sharp knife, hot water bottle, ice bag, matchbox, scissors, tourniquet, spoon, etc. School clinic and medical service. Every school should set up a school dispensary to look after the health of pupils, to arrange for medical examination of the pupils from time to time, to guide the pupils to adopt preventive measures against various diseases, and to provide treatment of minor ailments. A group of schools in a place may combine and set up a dispensary under the charge of a qualified medical officer. In case any teacher finds a student not keeping well, they should send him or her to the dispensary and ensure that treatment at the clinic is satisfactorily carried out. There should be a full-time dispenser in the school dispensary who may be able to take care of the cases in the absence of a medical officer. A regular supply of essential medicines should be maintained in the dispensary. The students should be advised not to hesitate but report in the dispensary if they feel any trouble. The dispensary should maintain the record of the medical examinations of the students held from time to time. The services of the school dispensary should be available to the public in times of emergency. The school medical service. An efficient school medical service is regarded as essential in any good school. In India, the provision is very important in view of the absence of health consciousness among the masses, poverty of the masses, non-availability of balanced diet to the growing children, unhygienic conditions and all-round and non-availability of medical facilities in the countryside. Health service agencies. The health service in the schools can be provided through the cooperation of various agencies like Physical Education Department, the Red Cross Unit, the School Dispensary and School Medical Officer, local public hospitals and local private practitioners. Program of medical service. This program will consist of medical inspection of the students after regular intervals, maintenance of records of these medical inspections, sending reports of the students' health to their guardians, clinical treatment of students suffering from ailments, follow-up program of occasional medical inspections, recording of history of chronic cases, provision of midday meals, ensuring regular physical exercise for the students, attending to sanitation and hygienic conditions in the school, and keeping the school campus healthy and clean. We shall now discuss cardiopulmonary resuscitation or CPR. Cardiopulmonary resuscitation or CPR is a life-saving technique useful in many emergencies including heart attack or near drowning, in which someone's breathing or heartbeat has stopped. CPR is an emergency procedure that combines chest compressions often with artificial ventilation in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person who is in cardiac arrest. CPR alone is unlikely to restart the heart. Its main purpose is to restore partial flow of oxygenated blood to the brain and heart. CPR is a combination of rescue breathing, which provides oxygen to a person's lungs, chest compressions, which keep the person's blood circulating. CPR, cardio meaning heart, pulmonary or lungs, resuscitation meaning revival. CPR dramatically increases the casualty's chance of survival, and without oxygen the brain can survive about 5 minutes before permanent damage sets in. We shall now see some of the causes of CPR. In adults, many reasons that heartbeat and breathing stop include drug overdose, excessive bleeding, heart disease, infection in the bloodstream or sepsis, injuries and accidents, near drowning and stroke. The symptoms of CPR: no breathing or difficulty in breathing, that is gasping, no pulse and unconsciousness. Steps in CPR: check the scene of the person, call for assistance, open the airway, check the breathing, push hard, push fast, deliver rescue breaths and continue CPR steps. Administering CPR. Steps for hands only CPR. Survey the scene, check the person for responsiveness, contact their heart with an automated external defibrillator, position your hand on their chest, begin compression, continue compressions, Steps for mouth to mouth resuscitation. Perform hands only CPR, open their airway, give rescue breaths, alternate rescue breathing with chest compressions. We shall now summarize the topics we have just discussed. Accidents may occur in schools, example falling down on the road, injuries in the playground, spraining of foot because of pushing out of fun, injury as a result of slipping while running and falling of acid on clothes while doing experiments in science class, etc. Taking into account all these circumstances, every teacher should have complete acquaintance with first aid so that assistance may be rendered to the injured before the arrival of the doctor. First aid is the important prompt aid given to a victim of an accident or sudden illness by any person before the services of a doctor are obtained. Although it is not the purpose of first aider to treat the disease, it helps the victim in many ways. It preserves life, prevents aggravation of the disease or trouble, assists in recovery, controls the trouble for some time and preserves the morale of the victim to fight the trouble. CPR is a life-saving medical procedure which is given to someone who is in cardiac arrest. It helps to pump blood around the person's body when their heart cannot do it. Thank you for watching the session on first aid. We will see again with a continuation of this topic. Till then, have a good day.